Welcome, I'm Len Matheson. Today's topic is how to promote interdisciplinary care at the intersection of faith and neuroscience to produce high quality of life in our clients. I'm going to share with you some of the things I do in my practice to help you develop your practice. Why should we be concerned about interdisciplinary care? Well, it's because the biopsychosocial healthcare model provides optimum results. We believe that this includes an important spiritual component. What we might call a biopsychosocial spiritual model of care is best delivered by an interdisciplinary team. At minimum, this includes a therapist and a physician. An interdisciplinary team is necessary to meet best practice guidelines. One of the tools that I use to promote this in my practice is the Counseling Progress Assessment Report. The CPA starts with a confidential online questionnaire that takes about 5 minutes to administer. This can be done in your office, or I prefer to have the client complete this at home. After we set our first appointment on the telephone, I send an email to the client with the link to the online questionnaire. I have the client complete the CPA prior to coming in for the initial interview. The CPA is composed of 31 items, including 3 subtests of 8 items each from the National Institutes of Health PROMIS program. The 3 PROMIS measures address anxiety and depression and sleep disturbance. We also measure quality of life using the Kemp Quality of Life Rating Scale. There are 5 items from the Santa Clara Religious Faith Questionnaire and 1 item that allows the client to tell us whether or not he or she has a faith or religious preference. In other lessons, I explain how to use the data from the CPA to produce the CPA report. But before we go too far, I want to tell you about the PROMIS program. PROMIS is an acronym that stands for Patient Reported Outcomes Measurement Information System. The National Institutes of Health PROMIS questionnaires ask people to rate their health status and progress. PROMIS gauges both the need for care and the progress that the person is making. PROMIS is also a very useful guide to treatment planning, which is the primary purpose behind the Counseling Progress Assessment program. The CPA questionnaire is used to develop a 5-page HIPAA-compliant PDF report that is sent to the counselor. I print this out prior to our initial session and review the first 3 pages with the client as we get started. Most of my clients really appreciate getting something tangible from me at our first session, so I copy the first 3 pages and provide them to the client. The first page of the report describes the client's responses, which we review together to identify any significant outliers. The next page is a clinical interpretation report. I review this with the client to help the client understand where he or she stands in comparison with other American adults. One of the great things about the NIH PROMIS tests is that they've been carefully developed using samples of normal people. The normative database is comprised of Americans who do not have a psychiatric diagnosis. This is really important because for the first time, we have the opportunity to help people get a handle on where they stand in terms of symptoms that we all have from time to time. It helps people understand whether or not, for instance, their symptoms of anxiety are typical. This allows the client to have a better handle on his or her need for services. It also helps the professional determine the kinds of services that may be necessary. On the 3rd page of the CPA report, we start to develop the client-centered interdisciplinary treatment plan. This is a basic, structured intake interview that collects information that expands on the CPA data. The 4th page of the CPA report is not provided to the client. This helps the professional focus in on appropriate diagnoses based on the CPA data collected and the interdisciplinary treatment plan. The last page of the CPA report is used to initiate the interdisciplinary relationship with the client's physician. After I review it with the client and have the client's authorization signature, I fax it to the client's physician. It introduces the practitioner to the physician so that they can easily communicate. It combats the siloization of healthcare that can severely limit best practices. We have additional videos in this series that will go into detail about each component of the CPA program. If you'd like to try it out for yourself, The CPA is available to counselors, psychologists, and social workers, and to interns and provisionally licensed professionals through their supervisor. We also support the free trial use of the CPA in clinical internship and residency programs. Contact us at faithfulbrain.com for further information. Thank you for your attention.